All right. Hello, everyone. Welcome to the TribalHub webinar. We are joined today with NextGen Healthcare, and the webinar is how Feather River improved access and reduced no-shows with technology. So we're going to learn a lot of great and helpful information. Um, Also, we're gonna, we'll begin in a few minutes. We'll let the attendees all arrive. In the meantime, if you guys want to drop into the chat box where you're all joining in from, we've got already with our panelists, we have Michigan, California, Arizona, Texas. So we're kind of already covering the coastline. So let us know where you guys are joining in from. Special thanks to our presenters today. Again, NextGen Healthcare. They are a TribalHub Associate member. We've got Julie and Kenneth with us that will be presenting, as well as Mike and Erica from Feather River. Sorry, I keep stuttering today. It's fine. Um, So some of the top learning objectives today, we're going to discover how Feather River Tribal Health improved patient access and reduced no-show um, no-shows by replacing manual scheduling and outreach workflows with automated patient-centered engagement tools without adding staff. So that's going to be really interesting. And we're also going to learn practical strategies to reduce call volume, streamline scheduling operations, and create a more convenient patient experience while still empowering staff to focus more time on care delivery. So, um, throughout, if you guys have any questions, please just go ahead and put them right in the chat box and we'll answer those as they come in. Looks like we have some Florida, some more California and Texas, Nevada, New Mexico. Great, more California again. Awesome. That's exciting. Oh, there we go. We've got now Oregon, Wisconsin, North Carolina. I bet we've got also a spectrum of weather going on right now too with all those states. I know last week in Michigan we had it was like 90 degrees, and then the next day we had tornado warnings, and then this week it's rain and like 60. So, all right. If you'd like, Ken, we can go ahead and start. I'll turn it over to you and you can get started.
Absolutely. Good morning and good afternoon, everyone from Tucson, Arizona. My name is Ken Kontowitz. I am what is known at NextGen as a client service director, and my singular responsibility is tribal health. I have been with NextGen off and on since 1999. And big milestone, I'll be retiring September 1 of this year, which breaks the heart for Mike and Erica because Feather River happens to be one of my favorite clients in the tribal space. Um, I assumed responsibility for Feather River about 2.5 years ago, and it's been a journey. It's been a journey of watching Feather River evolve. And one of the things that we've recently, actually about a year and a half ago, when Mike and Erica implemented patient engagement tools as well as population health to see their evolution as a fully integrated health system. And recently we wrapped up our tribal users group in Sacramento, actually at one of the Feather River owned facilities, Sacramento Hard Rock. And the Feather River team ended up winning the Tribal Innovation Award for what they're going to be sharing today. Phenomenal story of addressing a perpetual problem in tribal space, no shows, increasing revenue without substantial additions of providers, exam rooms. But this really speaks to leveraging technology and how technology can be your friend and a force multiplier. And on that, I'm going to turn it over to Erica and Mike.
Thank you, everybody. Thank you, Ken and Monica, for having us. So give me a second here while I figure out how to share my screen. and then we'll get this going for everybody. All right, so hopefully you all can see that. So my name's Mike Harris. I'm the CIO here at Feather River Tribal Health. I've been with the organization for about 14 years. I've seen the organization through a handful of transformations from, a very, I won't say a small facility, but a medium-sized facility. We used RPMS in the past. And so we moved to NextGen. It's about 9 years with NextGen, which has really kind of allowed us to grow with our community. And Erica, I'll let you introduce yourself.
Hi, everybody. My name is Erica Garcia. I am the current Director of Quality and Compliance. I too have been with the organization for about 14 years. I've had multiple job titles in that time. One of my favorites was IT when we implemented NextGen with Mike. Happy to be here.
So just a little bit about our organization. We're a tribal health center, a 501c3 health center, located in Oroville, California. We serve about 8,000 unique patients annually. We serve Butte, Yuba, and Sutter counties. So that's a very, the far northern part of California. Right now it's really hot out. But we provide holistic care to our patients, medical, dental, behavioral health. We have outreach services. We have a handful of specialties along the lines of chiropractic, physical therapy, acupuncture, as well as, I believe, endocrinology, rheumatology, and neurology. So we have a very diverse set of providers. We provide a lot of care. Our tribal health center is home base for all of our patients. And that demographic breaks down to about 60% of our folks are tribal patients, and then 40% are non-tribal. We have 3 clinics. Our headquarters here in Oroville, and then right next door to our headquarters is our wellness center. And then we have a satellite clinic in Yuba City. And thinking about some of the projects we've had over the years, and why we decided to look at both population health and patient engagement. Moving from RPMS to NextGen for us really was about visibility. Our old EMR system didn't have a lot of visibility into how we were performing. We were relying on other organizations to give us that data. And so we really wanted to bring things into our own hands. We wanted to control our own destiny and not have to rely on someone else to get us that information. And so, when we will talk about population health here, population health for us was a want by our providers. And there was, I think, at one of the conferences, Erica had come back and she says, I just saw this population health program. This is great. We have to have it. And so we brought in our leadership team, and it was really for us a way to again look at what we're doing with the reporting functionalities within the NextGen enterprise system. This really kind of for us took it to that next level. In real time, we're able to see, how our providers are doing, gaps in care, a lot of, patient-centric data that was really needed at the point of care. And so again, here the slide talks about making, needing those dashboards, needing that visibility. And so for us, it started with GIPRA, right? The government reporting and performance. But for us, over time, it evolved into, how are we doing with HEDIS and with our managed care payers? And so, Erica, did you want to add anything to that before I continue?
Regarding population health specifically, I'm in population health every single day. I spend a lot of my day in there, looking at different ways to view the patients, to view the measures. I love and enjoy seeing that increase in real time on a day-to-day basis. prior to getting population health, we couldn't see if we were moving the needle as far as the measures go. Our providers, they don't really love hearing that they have to do these things because we said so. Having it more centered around preventative care. So we've been able to broadcast this more to a clinic-wide initiative as far as everybody paying more attention to population health. We're getting those quality care measures met, getting the preventative screenings for our patients. So it's been invaluable.
I think to kind of add on to what Erica was talking about, for a long time, our providers were always asking us, hey, how are we doing? How are we doing? And this allows the providers to get that immediate feedback, right? So, the going through the clicks and the workflows that sometimes it's out in the ether as to how the providers are performing, and you're able to give them that, something real, something tangible, where you can say, hey, you're doing great, or hey, you maybe you need to improve here, but it allows the clinic and the providers to focus on areas that we couldn't in the past. And I think here the slide really kind of highlights some of those really great things that we were seeing with population health, the huge improvements where, you know, in the past we oh, are those clicks counting? But now we can target that outreach, those campaigns, to specific patients. We know when they're coming in at that, hey, they're due for X, Y, and Z. We're no longer really reliant upon staff to cull the chart and find those things. That population health digs them out and puts them in a very presentable way, easy for the providers and the staff to ingest and act upon. I'll just pause here real quick. Did anyone have any questions? I don't think I can see the chat. Let me pull that out. I don't know if anyone's got any questions or. But I'm all for, if you guys please blurt out your questions. I'd be happy to answer them. I'm more of a free form talker than I am a sticking to a presentation. So,
hey, Mike, I've got a follow up for you.
Yes, sir.
How did better data change the way your teams identified patients? And what I'm looking at on that one, Erica, is risk stratification, identifying potential frequent flyers, identifying gaps in care, and then turning that into campaigns.
So within population health, for those who are not as familiar with the product, you can easily identify your high-risk patients. And one of the things I really enjoy about it as well is seeing the patients who haven't been in for 2 years or 3 years. So we can reach out to those patients. Our outreach team, they call the patients, try to get them back in. Are there any barriers to care as to why they haven't been in clinic for a significant period of time? So those things have been really, really good. And then narrowing down to specific measures, or different conditions that the patient may have. So the population health allows you to identify any diabetic patients who also have depression or have other specific conditions, where you can take those and merge them to see who are your patients who have those specific 1, 2, or 3, so that we can reach those patients as well. So that's been really interesting tool. And then where the patients live. So we're able to see that easily as well. So when different things come up, whether it's heat or the fires that we get typically pretty often, we can see what patients are affected immediately to try and see if they need any assistance. I don't know if Mike wants to add anything onto that.
Yeah, and in regards to our outreach, I believe this was last year. Our outreach team really wanted to highlight the use of population health, and so we kind of came together as a team and decided that we'd highlight a measure every single month. And so through the use of Pop Health, we ended up at one of our events. We had a spring gathering event where we invited, it was a community event. We had a lot of cultural activities and things like that to kind of reconnect. And we had our QI team, actually Erica's team was out there, working with the patients and saying, hey, you're due for X, Y, and Z. So we were able to bring up their chart, give them a little printout of what they were due for, so that on their next provider visit, and just kind of bring awareness. But we'll talk about patient engagement and how we kind of merge the two worlds, so to speak, in a little bit. But population health has been really great for some of those other things where we didn't really, not just in clinic, but outside the clinic as well. So patient engagement. So this was something really awesome. We were using a standard, texting platform where we configured the messages. It would send out reminders to our patients the day before or whatnot, a couple of days before, and it was really kind of clunky. Where the messages would go out, the patients would respond, X C to confirm or X to cancel. And every once in a while we'd get some one-offs where they'd send up oh, hey, do I have transportation tomorrow? Or hey, I know that I've got 2 appointments. I need to reschedule this other one, right? And so that required our staff to run reports, monitor these, and then go back out and call the patient. And so taking this back, our board wasn't really happy with how it worked. There was complaints from patients. It was just kind of confusing. And so Erica and I set out on a quest to find a new solution. And we had run into patient engagement, and realistically implementing it only for that use case, right? We're only wanting to use it for getting the word out to the patients about their appointments. But realistically, that kind of opened Pandora's box with a myriad of other things that we ended up doing. But one of the great things that we noticed as soon as Luma what was implemented is the fact that we now had a bidirectional communication with the patient, right? So no longer did those one-offs get stuck in a report that our staff could have to go and cull through and then make a phone call. Right from the patient engagement interface, they're able to send a message directly back to the patient. Oh, do I have transportation with my appointment? Yes, you do. So it reduced a bunch of barriers. It allowed our front desk staff to really open that dialogue where it was just again just that one-way response back from the patient. And I think that's been really great for us. As you can see, our numbers that having an effective strategy with getting these reminders out, we had a significant overall decrease in no-shows. But I've just run the numbers for the current year, and we're doing even better than that. So the numbers are looking absolutely great. Specifically around our behavioral health and dental departments. This is where we've seen the biggest increase or decrease, I should say, in no-show rates. Erica, did you want to add anything to that?
Yeah, so Luma was hugely important to me. I spent 5 years working in medical reception, so I understood what the staff had to do on a day-to-day basis, and I understood how beneficial this would be. And as the generations move, technology is more and more important. So being able to communicate with the patient via what looks like a text message has been really invaluable. I happen to love communicating with our patients. So my team, if we happen to get a message that doesn't route correctly, my team reroutes them. And so sometimes I get to interact with the patients, which I miss. I miss that part of what I do. I don't get to do patient care so much anymore. But our patients seem to be really receptive. Our engagement rate was really high also from our patients, which was really great to see. So they were enjoying it. I don't know if you want to elaborate more on how we've expanded.
Yeah, and just to kind of touch on a couple of these points here. You know, we talk about no-shows a lot, and I think, you know, I'm not sure if everyone on this call is in tribal health, but specifically for us in tribal health, no-shows are always a problem. That, you know, it's not something that we're going to solve. But I think, you know, we need to look at the other side of that coin is a solution like this, not just reducing the no-show rate, but removing those barriers so the patients can, you know, if they're not going to make the appointment, that they have multiple opportunities to cancel so that our staff can to fill that, you know, to fill those slots. As you can see here, you know, we've got almost 10,000 new appointments year over year, which was absolutely huge for us. All right. And again, as Ken said at the beginning, we really had no increase to providers. Obviously, there's always some turnover, but looking at the numbers, our provider year to year, our provider numbers stayed steady. In fact, we actually had less providers between fiscal year 23-24 to fiscal year 24-25. So we actually did better scheduling more patients with less providers, which is absolutely great. And this year we, you know, with the great success that patient engagement has been for us, we decided to implement patient self-scheduling and wait lists. And so those solutions are, you know, we're still looking at right now. We're still getting those off the ground, but we're super excited to you know, bring in those barriers, you know, to reduce those barriers, to allow our patients, you know, easy access to schedule their appointment when they want, when they need it, when, you know, if they, you know, something's happening at 10 o'clock at night and the clinic's closed, that they can go to our website and go to the self-scheduling link and just book themselves an appointment. They don't have to wait until 8 o'clock or 7 o'clock when the front desk opens to get an appointment. Right. So it's reducing those barriers, allowing patients the convenience, right? Technology is increasing that, allowing the patients when, you know, when they want it. So which has been great for us.
And I will add, I don't think you said, when the patient cancels via Luma, it does cancel it within our schedule so that the staff do not have to watch a report and manually cancel those appointments. So it immediately opens those up for other patients.
Right. And so all of that, right? Reduced no-shows, increased total amount of appointments. Last year for us was the highest grossing year for us ever. I don't remember the exact percentage, but it was I believe 30 something percent increase, with, you know, more than 6 million um, uh, in recouped revenue from all that. But, you know, I think, you know, the no-show numbers and all this stuff, I think what it boils down to is making sure that, you know, us as a tribal healthcare facility is able to reinvest that back into our patients and to our staff. Right. And so, you know, we've been able to, you know, increase the amount of providers and hire pediatricians and different specialists and hire, you know, our peer support specialists and stuff for our substance use program, making sure that you know, the clinic has, you know, new equipment and things, you know, investing these, you know, reinvesting this back into a place where both the patients and the staff can see that, right? And that's important. That it's, you know, not just about that bottom line, but making sure that every dollar is used to, you know, support our patient care. So anything else did you want to add there, Erica or Ken?
As far as adding within the clinic, we're looking at taking some of this, continuing our spring gathering, making that an annual event. We're going to do a back to school event for kids who come to the clinic, so that we're going to give them backpacks that are stuffed with the different things they're going to need for school. Our diabetic program has grown leaps and bounds. At our wellness center, we are able to expand our exercise program, which our patients are really, really, really enjoying. We are doing a cooking class. We have our garden that our elders are very active participants in and have a passion for. Things that we had been wanting to do for some time, that we're in the last year just opening up a lot more different avenues for our patients.
And Eric and Mike, that's all made possible by, in large part, by this $6 million increase in revenue that you all have seen. I know you guys are going through a pretty substantial expansion on your campus, in addition to all of these additional services that you guys are going to be offering.
Yeah, a lot of the stuff that you're seeing on the screen, these are non-billable services, things that we provide to our native patients and some of our other patients. But making sure that everything is efficient as possible, again, leads back to what can we give back to our patients, and what other services can we provide by tightening up things where we can, and using technology as a force multiplier. I think it's absolutely great that we're looking at expanding our Yuba City clinic. I think Yuba County and Sutter counties are definitely underserved, and being able to have a stronger presence there is going to be great for us. Being able to provide all of these services and more to our patients in those counties, because the majority of our specialties are here in Oroville, and so those folks who are living in those counties have to drive 30 to 40 minutes to see those, and that still can be quite inconvenient and make it difficult, a hardship on those patients. So being able to provide those services where they live is absolutely a wonderful thing for us.
So clearly, patient engagement has been a huge driver for you all. How do you see it further transforming your organization? Where do you all see patient engagement and the technologies you guys are implementing further changing your organization?
I think for me, integrating this into, transportation and some of the other services that we're providing. So, right now we're really utilizing it for those clinic-based services, but, expanding it out to, those ancillary services that we may not be providing reminders for, or, using the broadcast to, let it be known that, hey, we're having these community events, and really interacting with our patients, and being able to, just communicate better, right? Just that's really what it boils down to, is being, giving them that visibility, right? We've implemented these to have more visibility and insight into our systems, but it really kind of helps the patient in that same way, where we're able to, communicate better and educate them through all this technology.
Yeah, and I would say within Luma, utilizing the features that allow us to submit forms to our patients prior to the appointments. So that way they can get those forms done in advance, so the providers, if they need to review them, have that opportunity ahead of time. It lessens the burden as far as the health information staff are having to scan, because those go directly into the chart. We're looking into some other features Luma has, so that some of the data writes back to NextGen, which I think will be really, really beneficial, save time for staff. And what I will say is, integrating these solutions did not remove jobs in any way. So where staff may have been, insecure adding technology, because technology, they feel you don't need somebody to do it if the computer can do it for you. But we didn't lose any staff. Integrating more services, it just empowered them to be more face-to-face and offer the amazing patient care. So that was one huge benefit. And then tying Luma into Pop Health, we've been using, we export our lists for different metrics into Luma to send those broadcast messages to specific patients who are due for measures. So in the coming year, my staff are going to be doing a lot more outreach to our patients directly, one-on-one, instead of the broadcast, to communicate with them to see if we can get them in to get an appointment, since people seem to respond better to a text message than calling them on the phone. So we can use Luma and that direct patient interface to try and improve the engagement and the metrics.
Excellent. So I do have a follow-up on that one. I know your leadership team, obviously know you guys really well. I can't imagine you guys are going through this effort without having a long-term goal. What does that goal look like for you guys? What does the promised land of transformation look like?
Oh.
Ever evolving.
Shucks. I think, for me as the CIO, is to get to a place where, number one, like Erica said, that our technology is allowing our staff to be face to face with the patients, right? For a long time that we've talked about the EMRs and such being, a hindrance to patient care, and all this technology has negatively impacted patient care. And I think, we're getting to a point now where we can start using technology to make things better. And I think that, both of these solutions really highlight that for us, as to, not just, the what we intended to get out of them, but some of those unintended consequences, those unintended benefits that have really highlighted themselves, where we're able to now give back to our patients, reinvest that into the clinic, being able to make our staff more efficient, get more patients in. Right at the end of the day, it's about providing great patient care for us. And I think, for me, ensuring that technology is reducing those barriers, that any solution we implement is only increasing the ability of our staff to work with our patients more easily.
Yeah, I'd say provider satisfaction, our staff feeling empowered and less burdened or feeling overworked, because in tribal health we all wear multiple hats every single day. Our patients being happy, satisfied patients is amazing. Well taken care of patients is amazing. And then with our preventative measures is ensuring that our patients are getting those preventative measures, because it's good patient care. And then a benefit in those things, and then and our no-show rates dropping and our appointments increasing is the further growth in revenue, which allows us to expand services, which I believe benefits everybody. And I'm looking forward to expanding in multiple areas and places. And these things are going to allow us to do that.
That's awesome. So last question from me, and then we can obviously bring in questions from the audience and the other panelists. But having worked with tribal orgs for the better part of 20 years, you guys are clearly on a phenomenal path of transformation. It's obviously paid off in spades for you all. For those tribal groups that recognize they need to make some significant changes, whether or not it's financial, to better empower success on that side, clinical insights like you guys have achieved, better patient engagement. What's a good starting point for organizations to start on this path?
I think for me, is really kind of look inward and understand your pain points, right? For us, it started with having that visibility. Like that was our primary objective with population health. Is really looking at is what is most important to your clinic, right? And what the next step that would be, what is the solution that's going to bring the most value? So, oh, you may have two competing projects, but how do prioritize that? Which one's going to bring most value to your organization? And making sure that, as you go through that, you have, folks involved that are, subject matter experts, and, all your department heads or your leads come in and have input, because those are the people who are doing the work, right? They need to be, you need to hear those voices, and so that should inform your decisions as to, where you move first. But for me as CIO, it's my job to ensure that, obviously staying on budget and delivering, but value is where it's at. So IT, it's always going to be an expense. We don't make money in IT, and so the things that we do have to be able to deliver that value. So patient engagement or population health, that we see these used outside of that original use case. And so my suggestion, my advice for those looking again, look inside your organization. What are those pain points? What's really important to your organization? And then kind of focus your efforts one at a time, um, and then find those projects they're going to deliver that value for you.
Yeah, I'd agree. You kind of answered how I would, which was see what the greatest need is, and begin there. Where Mike's focus is more on the technology side, my focus is improvement, and how can we get better and how can we make things better. So unfortunately for leadership, at least here, we get something done, and my next thing is I got to raise the bar. How can we do something better or something different? So that's a lot of what I do, and I'm thankful that we have a great leadership team who allowed us to explore and get these solutions.
Agree.
Agreed. Both in clinic and with your counsel.
Yes.
Hey,
Monica,
oh, sorry, Kat.
no,
I was
I
gonna
was just to
say,
let you know that I was done with my questions
okay.
for the team.
Perfect. I was gonna say I was taking like so many notes. I used to work in healthcare, and I thought that, one of the best parts that you guys talked about was the growth that gives back, because everything that you listed under there was also education. So you're like not just providing the care to the patients, but also education. So you're doing like diabetes management, a nutritionist, personal trainer. I think that that's amazing because, like you said, a lot of healthcare in general is not preventative, it's reactive. And so I think that, you guys just have something amazing going here. So it's so interesting to learn about. Um, and then it doesn't look like we have any other questions. If anybody does want to type in any questions, and then I was going to ask you, Mike and Erica, both, if you guys could tell the attendees one main takeaway, what would it be, or what is something that maybe surprised you in this journey, or something you weren't expecting that maybe was a roadblock, and how did you beat that roadblock?
So I don't know, Erica, if you want to answer, because I feel like if I answer, I'm going to take your answer. But all right, I'm just going to steamroll you here. So for me, it's how vital, for patient engagement, that two-way communication is. I think that's one of the biggest thing. I talked about unintended benefits, right? Um, Being able to converse with the patients, right? We have a process in place where when patient engagement gets a response back that's not a, confirm or cancel or reschedule, we've got a process now that deals with those kind of one-off messages, where staff will now get to, let the patient know, hey, yeah, you do have transportation, or where we can answer, oh, hey, when does the clinic close, or when does the pharmacy close? We can answer all those questions right from the patient engagement platform. But I think that again, that communication channel for us has been, I think, vitally important. Now it's something that I think I dare to say we rely on.
Yeah, my answer would actually not be that.
Oh.
Um, Population health. It's this solution that I wanted and I fought for so long. There was an initial barrier, but I'm a very persistent person, and I love being able to see and be able to answer to what patients are in need of different things or haven't been in the clinic, all that visibility, and the providers wanting to know that information, and now they can see it. And then population health I feel like is evolving constantly and improving constantly within the solution, which I love. They just put in there a daily rally, which is very beneficial for those morning huddles with the team. And within there, it allows Mike and I to see our growth year over year, which is really good. And those are things we want to report to our board of directors. So when we have to report those statistics, it's so great to have something that's so visually easy that we don't have to run a ton of reports for.
Yeah, that's awesome. And even, another huge thing was the no-show reduction rates. That's huge. And, if somebody cancels, somebody else can grab that appointment. That's awesome because I know normally you're waiting until Monday morning, you're calling the doctor hoping 20 people aren't ahead of you on the phone and that all the appointments already filled up. So I think that's awesome also. So. Is there anything else anybody, Mike, Erica, Ken, want to mention? Looks like we still don't have any questions.
Hey, Julie, given you're product manager on the Pop Health side, you have any follow-up questions for Erica and Mike?
Erica just kind of nailed down the daily rally conversation, and I will just add that, and also in response to Erica's comment about always evolving, that's exactly what we're doing, and we want to partner with our tribes at NextGen to do so. So, you haven't seen the last of the daily rally. We're going to be working to optimize that and bring even more information to the point of care. And so, if you think about kind of how we partner together with your clinic and with your settings. Is there anything, Erica or Mike, that you can think of that you would have seen progress with, right? Particularly, over time, and how has that worked for you?
So I know we'll go around the IDA and the IHS reporting for us. It was initially again, we could manage those metrics through our initiatives and such, but now you guys have developed the own reporting tool. So there's a whole section that's specifically for our IDA and our GIPR results, where we can, look at that data without having to worry about even to configure Pop Health to look at that. I mean, it's easy to begin with, but you guys have really done a great job in improving, and improving quickly, if I might add, the functionality regarding IHS reporting. So that for us, that's been another big benefit to Pop Health.
Thank you.
I will share, we recently purchased a machine to do some retinopathies in-house. That's been a huge thing we've wanted to do for quite some time as well. And I share with our nursing director that population health, you can easily identify what patients are due in clinic tomorrow, that are due for that retinopathy, so we can capture them while they're here. So that's something we're going to begin to do, because one of the biggest biggest issues we run into is the patient may be due for something and you can order it, but getting them to that appointment sometimes isn't always easy. So if they're in the clinic, we want to make sure we capture that measure. And I'm thankful to see that you can easily get that information out of population health.
So it looks like we have a question. Do providers log into Pop Health, or do they just use provided data? And is it used by the back office staff at all? Yes to all of those questions. So we do have some providers who want to be hands-on and want to look at their data. So absolutely, we make sure that they have it in their hands. It's also integrated with the EMR itself. So at the point of care, at the visit, that the providers or the ancillary staff can look at the patient profile right from the EHR without having to load population health. And so our back office does use it. So obviously, Erica's staff, our QI staff, use it, and our MAs and our ancillary support staff, they'll be in it to use the pre-audit. So we talked about the daily huddle and all that stuff. It's great information, and again, I think we didn't really touch on it too much, but the ability to give the information in a way that's usable and easy for the staff, where they're not having to, again, cull through the charts and find that information. It's all there, in an easy to see web page.
Right. And Mike and Erica, talk a little bit about, and you may have mentioned it, I may have been multitasking, point of care insights, right? Do your teams use that? And talk a little bit about that workflow.
Yeah. So again, in the EMR, there is a little status bar that has the patient's gaps in care, their risk scores. So again, without having to access Pop Health, the providers or the staff can just mouse over these little buttons, and it gives them the list of the gaps in care. Oh, the patient's due for their retinopathy, or they need their A1C. All of those things are available right there, at the click of a button.
It looks like somebody else had also asked, what NextGen interface is this for Pop Health?
So, I think maybe NextGen can probably answer this better than I can, but it feeds off of your production database. So there's a nightly feed. So when I come in the morning at 7 o'clock, it has all of yesterday's data. So, I mean, it's not 100% real time. But as of, last night, all of your, everything that's in the system when everyone went to bed last night and the doors got closed on the clinic, when you come in fresh in the morning, all that data is ready for you in Pop Health.
Right. And as you mentioned, Mike, already, it's a web-based application. And so another kind of a neat nuance is that once that your data aggregates and it loads within the Pop Health system, even if your EHR, and we know this doesn't ever happen, right, goes down, you will have some patient data within the last 24 hours, typically, to go by for your visits. So that's kind of an interesting or a great opportunity with some of the risk opportunities and things that you can gather from Pop Health.
Yeah, and I just kind of want to elaborate on that. We actually have had, we've done drills, and there's been times where our network connectivity has been limited, and we've had to lean on Pop Health and Luma for some of our remote sites to be able to get that patient data. Where we had a power outage at our Yuba City clinic, where we weren't able to have the internet wasn't up, and so we had little MiFis and hotspots that we got their laptops connected to the internet or their iPads, and connected them up, and they were still able to continue to see patients. Obviously, it wasn't the most ideal solution, but in a crisis, when you have everything's going wrong, you do have failover.
Yeah, we recently had our managed care pair, they have a requirement that we reach out to patients when they no show for one of their visits. And so we've been utilizing Luma to communicate with our patients when they have a no-show. We export the no-show information out of practice management into Luma and then are able to send broadcasts to those patients. So it's taken away some of that manual work for the staff, which has been really helpful as well, using technology in that way.
And it looks like somebody responded, just thank you. We have an interface too, but providers do not log into the web portal. If that makes sense, appreciate it. So, if there's no more questions, I just want to make sure nobody else has anything. Ken, Julie, Mike, Erica, anybody, anything else?
Yeah, I'll just in response to Sarah's comment about
Yeah.
providers not logging into the web portal. And I'm a nurse by profession, and I totally get that, and I don't want to do that either, right? So from a product perspective, that's 100% what we're always trying to do, is to get the right data in the care team's hands at the right time. And so when we talk about the daily rally that Erica mentioned, that is an current scenario that puts the right data in folks' hands, but it's not yet at the right place, right? And so that's what we're committed to doing right now, is improving that and getting it all the way to all the care teams so that they can use it quickly, because that's going to drive patient outcomes, right? And it's going to affect all of that all the way through. So I just wanted to kind of, when you talk about, we don't want you to have to log into the web and also the EHR and also, right? So that's definitely our primary goal.
That's awesome. Especially less logins mean less passwords that you forget.
Absolutely.
Well, thank you all again so much. Thank you, NextGen. Thank you, Feather River, Tribal Health. This webinar is recorded, so it will be emailed to all panelists and attendees. It will also be available on YouTube, and then it will also be available on TribalHub webpage. So anybody can access it, and that's it. Everybody have a great day, and thank you guys again so much.
Thank you. Thank you for having us.
Thank you.
All right, bye.
Bye-bye.